So this is going to be a very, very important question for you in your entrance exam. May that be NEET, may that be, INISET, may that be any kind of exam that is going to happen in the near future. This is going to be an absolute gold. This question is basically about one particular monitoring technique that we use in anesthesia, which is called as capnography. So before entering into the details of capnography, let me just read out the question for you. And once I have done that, then I'll give you a small glimpse or an idea about what capnography is and its significance in anesthesia. Okay. So in the image of the above given monitor, the number marked with arrow indicates the measure of. Now, before I start discussing this question, please let me tell that this is an INISET 2021 question. Okay, this is an INISET 2021 question. And if you see the INISET or AIMS questions in the last 3 to 4 years, or if you see the NEET PG 2021 question or the previous questions in the last 3 to 4 years, one mandatory question has come from capnography, and that is why I'll tell you that this is probably one of the most important topics in anesthesia. Essentially, it gives the anesthesiologist who's making the question a lot of opportunities to make image-based questions and clinical scenario-based questions. Okay. Now, so what does this particular value indicate is the question? Your options are oxygen pressure, carbon dioxide, airway pressure, and BIS, which is bispectral index. Now, the value that is being marked here is 38. Now, that 38 is actually nothing but end tidal carbon dioxide value. It is the end tidal carbon dioxide value, which is measured in millimeters of mercury. Okay, it is measured in millimeters of mercury. The normal value, which ranges basically between 35 to 45 millimeters of mercury. So end tidal carbon dioxide value is done by a monitor, which is called as capnography, and it essentially measures carbon dioxide in your expired air. Okay. Now, capnography is a very, very big topic. It has got so many images associated with it. So I'm only going to start my discussion off in capnography, and the subsequent classes, which is going to happen tomorrow and day after tomorrow, I'm going to actually give you further details on capnography, so that if you are someone who's trying to attend this particular number session, will have no doubts in capnography. And this is one thing I can guarantee you as one question in your exam. Okay. Now, what do you mean by capnography? So capnography is a respiratory monitor. The first and foremost thing that you should understand is that it is predominantly a respiratory monitor. Now, when you are doing anesthesia or when you are giving anesthesia, you can practice so many things, like you can monitor so many things, like you can monitor the patient's cardiovascular system, you can monitor the patient's respiratory system, you can also monitor the patient's temperature, etc., etc. So capnography is something which will be included in the main category called as respiratory monitor. And what does it measure? It measures a value which is called as end tidal carbon dioxide. It measures a value which is called as end tidal carbon dioxide. What do you mean by end tidal carbon dioxide? End tidal carbon dioxide is the partial pressure. It is the partial pressure of carbon dioxide in expired air. It is the partial pressure of carbon dioxide in expired air. Obviously, when you are breathing, you are going to inspire, you are going to expire. When you are expiring, you are going to have a lot of carbon dioxide in that expired air. So what are we doing here? We are measuring the partial pressure of carbon dioxide in expired air. Okay. So because we are measuring the partial pressure of carbon dioxide, the value of end tidal carbon dioxide will be in millimeters mercury. It will be in millimeters mercury, and the normal value of end tidal carbon dioxide is 35 to 45 millimeters of mercury. Now, please do remember this 35 to 45 millimeters of mercury is very, very important. Now, why do you think we are measuring end tidal carbon dioxide? We are measuring end tidal carbon dioxide as a surrogate for measuring a very, very important value, which is called as PaCO2. What do you mean by PaCO2? PaCO2 is the partial pressure of carbon dioxide in the arterial blood sample. So what are we trying to do? We are trying to just measure end tidal carbon dioxide as a surrogate value for measuring your PaCO2. Now, this is a very, very common question. What is the normal difference between PaCO2 and tidal carbon dioxide? Generally, they are representative of each other, but you can have a difference of 2 to 5 millimeters of mercury. And this is a neat super specialty question. So please do remember this value as well, because this can always be asked in your NEET PG exam as well as an INSET exam. Okay, so normal value is 35 to 45. The normal value of PaCO2 is also 35 to 45. Please do keep that in mind as well. Remember that this 35 to 45 is important because the normal pH of your body is also 7.35 to 7.45, right? So 3545 relationship is here as well. So please do remember 7.35 to 7.45. End-tidal carbon dioxide value 35 to 45 millimeters of mercury. PaCO2 value 35 to 40 millimeters of mercury. And the difference between or the gradient between PaCO2 and E2C2 in any given patient can range between 2 to 5 millimeters of mercury. If the difference is more than that, then there is some problem in your body. Okay, so that is what it means. A lot of conceptual questions, a lot of factual questions can also come in end-tidal carbon dioxide. Now, what are the other things that you should understand? First and foremost, why do you think it is important for you to measure end-tidal carbon dioxide? Why do you think it is important for you to measure end-tidal carbon dioxide? Or what is the relevance of carbon dioxide inside your body? First thing, remember about carbon dioxide and remember about carbon dioxide transport. Where how do you think your carbon dioxide is eliminated from the body? The carbon dioxide which is produced in the tissues will eventually be reaching your pulmonary circulation, and from there, with the help of respiration, the carbon dioxide is going to come out. So carbon dioxide is eliminated by your respiratory system. And that function of respiratory system by which carbon dioxide is eliminated is what is called as ventilation. So carbon dioxide assessment gives you an idea about the respiratory system, or to be more precise, it gives you an idea about the ventilatory status of the patient. Or when you have put the patient on a mechanical ventilator, you will know whether you are rightly ventilating the patient or not. Imagine the patient is not ventilating properly, means carbon dioxide is not being eliminated properly. Obviously, the PaCO2 is going to increase, and as a result of that, your EtCO2 is going to increase. So if you are having a progressive increase in end-tidal carbon dioxide value, it could indicate a hypoventilatory status. It could indicate a hypoventilatory status. So please do remember the significance. Similarly, imagine your end-tidal carbon dioxide is progressively coming down. Means all that carbon dioxide which is present inside your body is now being washed out. That basically means the patient is being hyperventilated. Now, when you are putting a patient in a ventilator, may that be during anesthesia, may that be during an ICU where the patient requires mechanical ventilation, you have to set the respiratory rate, and sometimes you will also have to set the tidal volume. So you control the ventilation essentially. So sometimes what you can do is you can sometimes put the patient in too much of tidal volume or too much of respiratory rate, and you might be hyperventilating the patient. Similarly, you might have set a very low respiratory rate or a very low tidal volume where you might be hyperventilating the patient. The only way that you can subjectively assess this is by looking at the carbon dioxide value. So you'll know whether you are hypoventilating or hyperventilating the patient just by looking at the carbon dioxide value. The value is less than 25, you are hyperventilating. The value is more than 35, you are hypoventilating the patient. Right? So this is one thing. Secondly, now, so it gives you an idea about the respiratory system and gives you an idea about the ventilatory status of the patient. Now, secondly, what is the significance of carbon dioxide? How do you think carbon dioxide is produced inside the body? Carbon dioxide is produced as a result of metabolism. It is the byproduct or waste product of aerobic metabolism, right? Because it is a byproduct or waste product of your aerobic metabolism, it can also let you know about the metabolic phase of the patient, or the metabolic state of the patient. There are certain disorders which are associated with hypermetabolism. There are certain disorders which are associated with hypometabolism. On that aspect, if you're an anesthesiologist, the most important hypermetabolic state that you can have is something which is called as malignant hyperthermia. If you remember our previous session, we were discussing about malignant hyperthermia, which is also a high yield topic in anesthesia. So malignant hyperthermia is an autosomal dominant condition. It is a genitopharmacological condition which is triggered by some pharmacological agents like inhalation anesthetic agent and depolarizing muscle relaxant. Now, once that happens, the skeletal muscles get driven into a hypermetabolic state, and as a result of that, there is increased production of carbon dioxide. The earliest intraoperative identification of malignant hyperthermia is done with the help of capnography, and that itself is a question. Similarly, you also have other metabolic conditions like hyperthyroidism, or imagine a patient is having thyrotoxic storm during the intraoperative period, you will know about that. Hypometabolic states like hypothyroidism, hypometabolic states like hypothermia can also be detected somewhat using your end-tidal carbon dioxide. The first function was in respiratory system. The second role was in your particular metabolic states. And thirdly, you know that it is produced in the tissues, but from the tissues, it has to be eventually transported into your particular pulmonary circulation. This transport is done with the help of your circulatory system. So it also gives you an idea about the circulatory status of your patient. So that is why it is very, very important in one condition which is called a CPR. If you have read the 2020 guidelines for CPR, they would have mentioned something which is called as high quality CPR. And high quality CPR includes what is the depth of compression, what is the rate of compression, etc., compression to recoil ratio, etc. But to subjectively assess this high quality CPR, what is the airway monitor they are advising? The airway monitor that they are advising is end-tidal carbon dioxide. So that airway monitor, which is frequently used in CPR, is also end-tidal carbon dioxide. The monitor that is used for assessing high quality CPR is end-tidal carbon dioxide. All are potential MCQs for you. So the monitor which is used to assess high quality CPR is high quality CPR is also your particular end-tidal carbon dioxide. Can know now why it is so significant. Also in circulatory system, it gives you an idea about a particular condition which is called as pulmonary embolism as well. How each of these situations will look like in end-tidal carbon dioxide, that is a discussion for another day. But today what I'm going to do is I'm just going to draw one particular capnograph and show you the genesis of a capnograph, and I'm going to finish up my discussion for today. Tomorrow and day after tomorrow, I'll be discussing the various different kinds of capnograph which can come in your question, and how do you diagnose it and how do you act upon it is going to be our next day's plan. So today I'm going to just make you understand. If you let me just take you back to that question here. You are seeing this particular graph here. Yeah. So let me use a different color. Okay. Yeah. So this is a different color here. If you can see this particular graph here, or this particular morphology that you're seeing here, is a normal capnography graph or end-tidal carbon dioxide graph. I want to make you understand how this particular graph gets its formation, and or the anatomy of this particular graph is very, very important for you to understand the different conditions which can lead to different morphologies. Yes or no? So let me just make you understand the genesis of your particular end-tidal carbon dioxide graph, or a time capnograph. Okay. Let me just draw a time capnograph here. So it is a graph, right? Because it is a graph, it is going to have an x-axis and a y-axis. So let me just draw an x-axis and y-axis here. This is your y-axis here. This is the x-axis here. So what are you having in the y-axis? It is the partial pressure of carbon dioxide in expired air, which is called as end-tidal carbon dioxide. And what are you having in the x-axis? It is time. So remember that when you are having time in the x-axis, that capnograph is what is called as time capnograph. If you are having volume here, then it is called as volume capnograph. Volume capnograph is not important for you as far as your exam is concerned. We are more concerned about the time capnograph. Right? Now, how do you understand capnograph? We are trying to understand the process of expiration, and we are trying to understand the amount of carbon dioxide in expiration. Okay. What is the first thing that is going to happen? Imagine that you are expiring, means you are doing the process of expiration, breathing. So the first gas that is going to come out of you when you are expiring is obviously the anatomical dead space gas. As you are expiring, the first gas is going to be that which is going to be present in your anatomical dead space. Now, what do you mean by dead space? Dead space itself means that it has not taken part in respiratory exchange. Remember, carbon dioxide enters into your air with the help of respiratory exchange. So if a respiratory exchange has not taken place, it essentially means that there is going to be no carbon dioxide. So the first phase of respiration, where there is only elimination of anatomical dead space gas, there is going to be no carbon dioxide. So this is phase 1 of your capnography, where there is absolutely no carbon dioxide. Now, after some time, what is going to happen? Your anatomical dead space gas is being eliminated, and along with that, some amount of alveolar gas is also going to come out. Now you know that alveolar gas means it has already taken part in respiratory exchange. But because it has taken part in respiratory exchange, it is going to have some carbon dioxide. So what is going to happen to the partial pressure of carbon dioxide in expired air? Obviously, it is going to increase slightly, right? It is going to increase like this. There is going to be a slight increase in your end tidal carbon dioxide value. What is going to happen post that after one particular point of time? So this is the phase 2 of your capnography. After this particular phase, what is going to happen? Obviously, all the anatomical dead space gas would have got exhausted. The only thing that is going to be remaining inside the patient is the alveolar air. Now, you know that if a patient is having a normal ventilation perfusion ratio, the amount of carbon dioxide that is there in your alveoli is more or less constant. Because the amount of air that is present in your alveoli is more or less constant, the elimination of carbon dioxide from your alveoli is also going to be more or less constant. Because it is characterized by a constant elimination of carbon dioxide, what are you going to get? You are going to get more or less a plateau phase here in the phase 3 of your expiration, right? So I've mentioned 3 phases of capnography. Phase 1 is where there is only elimination of anatomical dead space. Phase 2 is where there is elimination of anatomical dead space along with alveolar dead space. And phase 3 is where there is elimination of only alveolar air, right? Sorry, when I was mentioning 2, it is anatomical dead space and alveolar air. Third is just the pure elimination of alveolar air. And finally, once that alveolar air has gone out, there is end of the process which is called as, there is an end process which is called as expiration. Finally, you are going to inspire again, and in inspiration you are not going to have any carbon dioxide. So there is going to be a drastic decrease in this particular value, right? So if you see this particular baseline here, this baseline is having some part of inspiration, and again this phase 1 is going to start. Okay, so this baseline is shared by 2 important values. This inspiration is demarked as 0. Okay, this is phase 0 of your capnograph, and that phase 0 is going to continue here as well, and phase 1 is going to start from here. So this particular baseline is shared by phase 0 and phase 1 of your particular capnograph. Phase 0 is representative of inspiration, and phase 1 is representative of the first phase of expiration. So this is the normal capnograph. Let me just take you to that question once again. If you see, this is how it looks. So this is basically the phase 1. This is phase 1. This is phase 2. This is phase 3. And this is phase 0 of your capnograph, right? So this is how it looks like generally. And I want to just add 2 important points here. There is 2 angles which are formed here. One angle is formed between the phase 2 and phase 3 of your capnograph, and that angle is called as alpha angle. And there is an angle which is formed between phase 3 and phase 0, and this angle is called as beta angle. Normal value of alpha angle is around 110 degrees Celsius. Please do remember that. And the normal value of beta angle is around 90 degree. Please do remember that it has to be 90 degree normally, because in your inspiration, you actually do not expect any carbon dioxide. So if you have understood the genesis of this particular capnogram, then you will be able to understand the clinical applications of capnogram. Like I told you vaguely that it is used to understand the ventilatory status of the patient. Apart from that, in the respiratory system itself, it has got so many applications, starting from confirmation of endotracheal intubation. If you remember the NEET PG 2021 question, it was asking regarding the golden standard of confirmation of endotracheal intubation, and the answer is end tidal carbon dioxide. So how do you identify endotracheal intubation? How do you identify esophageal intubation? How do you identify endobronchial intubation, etc., 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 is going to be our topic for tomorrow. The question will be formed based on some kind of clinical application of capnograph for tomorrow, right? So I hope you enjoyed this basic idea of capnograph. This is the physiology of capnography. You have to be absolutely sure to understand the consequences and clinical significances of capnography. And once again, I just really want to reassure the fact that this is an absolutely gold question for you in your INICET exam. And very rarely you are going to have an exam without a question from capnography. You can get simple concept-based questions. You can get image-based questions. You can base clinical scenario-based questions from this topic. So when you study a topic, you also focus on the possibility of a question from that particular topic. And in that regard, this is absolute gold for you. Okay. So that is it for today. I'll come again tomorrow with capnography. So please read the capnography topic, and we'll continue our discussion on that. Okay. Thank you.
Best training, peaceful environment, PG medical entrance exam preparation were my expectations. I got them at Speed Medical Village in Kanchipuram. Today, I am a PG topper.
Speed Medical Village, a unique eco-friendly campus dedicated for PG preparation. Speed Medical Institute, a complete solution for medical education.